A 30-year-old who presents with a twisting injury with pain at the medial side of his ankle. And what we can appreciate in looking at the medial side of the anatomy, the posterior tibial tendon with some trace tenosynovitis, and looking at how it attaches to an inflamed os navicularis. So there's a synchondrosis between the os and the parent bone, and there's edema. And we can see this in multiple planes. Let's take a look at this sagittally. So we're watching the posterior tibial tendon come down, a small amount of tenosynovitis, and then we can appreciate its attachment on this os navicularis with its curved synchondrosis with no edema within this synchondrosis, but there is edema across, indicating there's been a stress response. And we can also follow the posterior tibial tendon not only to its insertion on the medial navicula, as we can see here, but further on the medial cuneiform, and then the bands attaching to the metatarsal bases so that we can appreciate some degree of synovitis. Let's take a look now at the deltoid ligament complex, the deep bands as they attach on the medial side of the talus, and appreciate this slight edema. Let's take a look where exactly that edema is along the medial talar neck, and we can appreciate these are the deep posterior and anterior bands of the deltoid. What we can see from the deep deltoid, we have this edema, and we're coming into the supromedial spring ligament here. Now, the investments anteriorly are from the tibionavicular, tibiospring, and tibiocalcaneal, and we can see the thickening in this region, and we can also cross-reference that and get a better idea of where that is coronally speaking. So I like to look for the sustentaculum talus and find that band, which seems to be connecting, and there is this area of thickening here, the tibiospring. And what we can see is that there's some stress-related edema at the medial talus in that location. Furthermore, looking at the vector of the talus itself and trying to understand the biomechanic for this person, we can appreciate that the talus seems to be having some chondral loss in this region, and also that the vector going in this direction would lie slightly medial to the hallux. It's giving us an idea, which we already can see biomechanically from the stress edema, of the overpronation biomechanic for this patient, so that we can appreciate the driver of the talar head through this region of the spring ligament towards the navicula and medially as this patient overpronates in medial ankle instability.